My name is Andrea. I am in Spokane, Washington, and I was 32 years old when I was diagnosed with stage 3 rectal cancer. I am a nurse practitioner. I was a ER nurse for a long time, going on about 10 years, and then I went to nurse practitioner school, and now I'm a nurse practitioner in the emergency department. I'm married. I have 2 beautiful kids. My first symptoms was when I was pregnant when my symptoms started with my son. I want to say it was like in June of 2021, and I just started having some like blood in my stool, which pregnancy, they're just like, that's normal. You can have hemorrhoids. It's completely normal for that to happen. I started to have a lot of really low back pain, and kind of just like some like pressure, like always feeling like I had to go to the bathroom. But again, they were like, well, your baby's sitting really low. He's sitting posterior. It's just pregnancy stuff. I had my son August 9th. And I remember, and this is like a lot of TMI, but I remember when I was in labor, I was having so much rectal pain, like just like severe, like contractions were nothing. And I just remember telling my husband, like, oh my gosh, like this hurts so bad. I feel like that there's no way this is just a hemorrhoid. Like this is so painful. And the kind of months after that were a little bit blurry. I really started to see more symptoms kind of in October, November-ish. I was having just really like every single bowel movement was bloody, and sometimes it would just be straight blood. It was just constant, and I was probably having like 15 to 20 bowel movements a day that were just blood. And I remember being like, okay, this is not normal. Something is not right here. And I went to my OB at my 6-week check, and I was like, hey, I want a referral to a GI doc. Like, this isn't right. And she was like, okay. So she referred me to a GI doc in Spokane, and they got me in relatively quickly, but was pretty disappointed at the appointment. I got really dismissed. A lot of my stuff was dismissed for pregnancy. I heard the words, you're way too young. You just had a baby. You have a bunch of hormones going through you. You had known hemorrhoids, like basically just dismissing my concerns. And I got told, well, we'll do a colonoscopy because that's the whole reason you're here, right? But we don't know when we'll be able to fit you in, kind of thing. So it was just more, I left feeling like, wow, am I stupid for even thinking like this is a thing? And so I came home and I told my husband, and he's like, well, that's pretty disappointing. But I was like, well, okay, well, we have the colonoscopy scheduled. And I think it was scheduled for like the very end of December or beginning of January at this point. In December, I will always remember this. I was at my cousin's basketball game, and I had a really like sudden onset of like a really severe like stomach cramp. And I went to the bathroom, and it was just like blood clots, like just, it was the worst one I've had. It was just bright red blood with dark red clots. And I was like, okay, like we've got to get this taken care of. And my husband is a nurse anesthetist and works at one of the local hospitals. And he actually contacted one of the GI docs that he works with and was like, listen, no one's taking my wife seriously. This is what's going on. Can we please get her in? And he was like, bring her in next week. I'll scope her right away. And so December 21st is when I got my colonoscopy, and it's when I got my diagnosis. And going into the colonoscopy, I knew, like, I'm a nurse practitioner. My husband's a nurse anesthetist. Like, we knew deep down. I remember my colonoscopy was on a Monday, and I remember Saturday, I told my husband, I was like, hey, we just need to prepare. Like, this is cancer. I know this is cancer. But still, a part of you wants to think, like, no, I'm just thinking the worst because I'm in healthcare. I'm just thinking the worst. But we kept saying, like, and, my husband was being so supportive, and he was just like, no, like you can't think like that. There's something else. It's not cancer. Like, and so when I went in for the colonoscopy, I actually wasn't terrified at all. I had no anxiety going into it, which is bizarre. It was right when I woke up from anesthesia. The doctor, he came over to me and he just put his hand on my leg, and he's like, there's a really big mass there. I'm so sorry. And I think in that moment, I was like, it was like how is this my life? Like, there's no way this is my real life. You never think it will happen to you ever. Like, and the first thought that's going through my head is, Okay, so there's a mass. Is it everywhere? I have two kids. How is this even possible right now? I was in the middle of going through nurse practitioner school. I was like, why even finish school? I don't want to go to school. I want to spend all my time with my children because if I don't have very much time left, and it really puts a lot of things into perspective of like, I could die within the next month. And you never, like, I know people say like, oh, well, like we never know what tomorrow looks like. But when you're handed that diagnosis, and you truly have to face like, wow, there is a very high chance that I could be gone within the next month. It is the most terrifying, sickening feeling I can even describe. Like I can't even describe the feeling I went through at that moment. The doctor came over and said, we're getting this looked at today. He's like, I've already scheduled you for an MRI. I'm getting you a CT scan today. I've already talked to an oncologist. I've already talked to a surgeon. I've already talked to a radiation oncologist. Like, he's like, I'm not letting you leave until we have a plan for you today. So it was about 7 centimeters, like up into the sigmoid colon. So it's technically considered rectal cancer. The MRI did show the tumor and it showed some lymph nodes, but it didn't show any masses anywhere else. So I had that relief of like, okay, so far it hasn't spread that I know of. I went home and like all I wanted to do was be around my kids, but at the same time I didn't want them to see me with how upset I was. So it was like I came home, I tried to be normal. So I got diagnosed like 4 days before Christmas. So it was kind of like we're a whirlwind of let's get your appointments going. So I actually got called by the radiation oncologist the very next day, and they were like, "Hey, we want to get you in today." And that was we're gonna map everything out for your radiation. And then I got called from the oncology office, and they were like, "Hey, we want to see you today to go over what your plan's gonna look like." And so I ended up going to the oncologist that next day, and he mapped everything out for me. He's like, basically, so the treatment guidelines for colon cancer versus rectal cancer are a little bit different, which I never really got. And he explained it to me, but I still was like, okay, just do what you need to do. But he said, we're going to start with radiation, where you're going to go under 28 treatments of radiation. And while you're going radiation, you're going to have a chemo pump. So you're going to have continuous chemotherapy infusing. And then once you complete those treatments, then you take I think like a week break from the chemo. And then you do 8 intensive treatments of chemotherapy where you come in and get the 4-hour infusions. And then after that, then you have surgery. And he did say, after your chemo, we rescan you, we kind of remap and see like what your tumor's doing. And there is a possibility that like if your tumor's gone, you don't have to have surgery. It's called the watch and wait, where we just see if the tumor is dead or if it comes back. And I'm like, absolutely not. You're taking that thing out. Like we're not watching and waiting for anything. He said, if it was an isolated tumor, we would take it out. But because mine was, and he said it was like the level of how much it had eroded into the colon, mine was very eroded in. Like if I would have waited a couple more months, I probably would have had a perforated colon. Like that's how bad it was. And because I had lymph node involvement, he's like, what we need to do is we need to get the chemo in there, kill what we can. The radiation was to kill the tumor, and the chemo was to kind of like stop the tumor cells that were floating around from like duplicating and things like that. So the side effects of the radiation, I didn't have too many. I had a lot of back pain, which they said would happen. So a lot of back pain, just achiness like in my pelvis. And the thing they told me before is that they said, we're radiating your uterus, your ovaries, like you're not going to be able to have any more children. So are you wanting, they did give me a chance. They said we can do what's called an ovarian transposition, where they pull the ovaries out of like the radiation field to try and salvage if you want to have kids. And I was like, listen, I have 2 healthy babies. Like I need to be there for them. I can't delay this any longer. So we kind of at that point knew that our family was going to be complete. But I had a lot of back pain. Fatigue from the radiation was insane. Like more fatigue than I had when I was pregnant with my son, when I was 12 weeks pregnant, I got COVID. And so and the fatigue from the radiation was like 20 times more than that. Like it was the most insane fatigue I've ever experienced in my life. which is weird because it was just this isolated like beam shooting your tumor. But and then the initial chemo pump, I didn't have any side effects other than my fingertips turned like different colors, which was weird. So I always explained it like it looked like I dipped my fingertips in self tanner. My oncologist was like, you can't work. You need to just rest. And I'm like, I'm not just going to sit at home and sulk. So I actually completed my last semester of nurse practitioner school while I was in chemo. And I used my chemo treatments as my study time away from my kids. So, keeping myself busy and just continuing to push through like really helped me. But I had days like there were absolutely times where it would hit me like, holy crap, I cannot believe this is what I'm going through. And I would have to go upstairs. I'd lock myself in my room so my kids didn't see me. And I would completely break down and just have a moment of just like hysterically crying, like ugly crying of why is this happening to me? Like, what did I do to have to go through this? And then I'd pop right out of it. One of my good friends, she's always like, okay, have your moment in pity city and then get yourself out of it and let's go. So I'd always just tell myself that, like, get out of pity city. We had our moment, time to get back. So after treatment was a little bit of a whirlwind. I was just starting my first job as a nurse practitioner, right after I completed treatment, right before I had my first surgery. They wanted to rescan me and see just how much the tumor had like shrank. So I ended up having another CT and an MRI. And I remember being at my very first day of work at my new job. I was training and I got the MyChart result like, okay, your CT scan's back. And I'm like, okay, I'm going to look at it. So I opened it up and the first thing I saw was a new lesion on the liver and my heart dropped. And I'm like, I went through all of this only for it to not work. And now I'm stage 4. And I remember just like the feeling of like, okay, I'm at my first job. I need to like get through this day. But at the same time, like, how is this possible? That day gives me more anxiety and just makes me like cringe more than the day I got diagnosed. Because it felt like I had gone through so much for it just to not work. And the next day I remember messaging my oncology team and I was like, can I have a phone call with my oncologist so we can talk about my CT scan? And she goes, yeah, he'll like do a telephone call with you or Zoom video. I was like, okay. So I went out to my car. I was again at work. I went out to my car and got on the call and he had my CT scan pulled up and he was there. And my oncologist, he's so great. He's so wonderful. But when he presents things, sometimes he doesn't have like, the most like upbeat tone. So I never know what to expect. And so I was sitting there and I was just waiting for him to tell me. And he goes, the spot on your liver, he's like, I am 99% sure is not cancer. And I was like, what? But he said it in such a calm tone. And I was like, really? And he's like, he's like, I actually have a call out to the liver specialist to just look at it. He's like, but I really don't think it is. He said, the chemo you have can really damage your liver. So at that moment I was like, oh my gosh. And I was like, so it's not spread. He's like, no, he said, your tumor has actually shrunk significantly. He's like, it's still there. He's like, we still need to do the surgery, but he's like, yeah, this spot on your liver, I'm just really not concerned about. But he said, but what's going to happen is the surgeon, she's actually going to step in on your surgery. So my surgery was scheduled for like 3 days after this. And he's like, she's actually going to go in and look at your liver herself and make sure there is nothing there. And I'm like, okay. So I felt a little bit better about that. So then 3 days later, I had to have the surgery, which is a pretty major surgery. It was quite, I can't remember how long I think I was under, but they basically go in and they resect the entire tumor plus a bunch of like size on one side of the tumor and the other side to make sure that it gets all taken out. And then at that point, the surgeon went in and looked at my liver too, to make sure that I didn't have any like spot on my liver at all. And then what they did was they did what's a temporary ileostomy. So where they basically take my colon and bring it out through my stomach to let like my surgery site heal. And I had to have that for like 10 weeks, 8 to 10 weeks. I had to be in the hospital for a couple days, which sucked, just to make sure that everything was working. And that was the first surgery. And then I had that ileostomy for about 8 to 10 weeks. And then I had to go in and have it reversed. So they go in and they just basically put my colon back together without that tumor in it. And that surgery was actually a little bit more intense. It was much more painful, even though it was a shorter surgery. When I got told about the ileostomy, my initial thoughts were like, I don't care. I just was in that mindset. Do what you need to do to get me better. I don't care. But when I actually came home with the ileostomy, it was a very big mental block for me. I felt like I didn't want to go out in public. I just was like disgusted. And being a nurse for so many years and seeing people with these, like I never minded taking care of them on other people, but I've never thought that I would have to have one. And I remember the first day that the home health nurse came over to like help me figure out how to change the bag and stuff. I couldn't do it. My husband had to do it because I was so emotionally distraught from it. And my husband actually just said, you don't ever have to look at this. I will take care of it for as long as like you have it. When I got it reversed, I just remember the doctor being like, okay, like, yes, it's getting reversed, but I'm just telling you right now, it's not going to be a walk in the park. Like we have removed a lot of your nerve endings. Like your colon has basically been asleep for the past how many, weeks. Like this could be basically you might have to potty train yourself again. And I was like, maybe I don't want it reversed. Like maybe I just want to like just keep it. There were so many times I wanted to give up. I remember telling my doctor, I was like, just give me the ileostomy back. I want it back. Like, I don't care. And she was like, you say that now. You're not going to say that in a month. I'm telling you, you're not going to say that in a month. I think that just again, having my moments of like, this sucks, I hate this, but then also like, look how far I've come. So technically I was remission on the day of my surgery, the day of my my first surgery when they pulled the whole tumor out. So June of 2022. Um, and I guess at that point I didn't necessarily think I was in remission because I was like, well, they still need a scan to make sure they got everything. They took the tumor out and they test the margins to make sure there was no tumor cells. And I had negative margins, which they said is really good. But unfortunately, I had like 8 lymph nodes that had live cells in it. And that puts you at such a high risk for recurrence. So because of that, they were like, we're going to have you on a really close scan blood work every 3 months for like 5 years. So it wasn't until probably my 3-month scan after that where they didn't see anything that I was like, okay, I really am officially like, I don't have the cancer in me anymore. But I don't think I've ever, and to this day, I still don't think I've ever gotten to the point where I don't feel that I have cancer. It's just, I think a part of me knows that someday it probably will come back. And I don't know how to get out of the mindset that it won't. Like, even though, my blood work, I get a CT scan and an MRI every 3 months. And then I get a tumor DNA test where they actually extract a DNA from my tumor and then they draw my blood every 3 months and they compare those so they can actually pick up if there's like tumor cells floating. Every single one's been negative since June of 2022. But I can't get in the mindset that it's gone. For self-advocating, like you can ask any of my friends. I am a huge advocate now for like self-advocating. I've had people reach out to me, on Facebook, on Instagram, who've seen my story and they're like, hey, I started to have these symptoms. I went to my doctor and my doctor was like, oh, we'll just follow up in a couple of months. I've been like, absolutely not. You find yourself a new doctor, you go to an urgent care, you go to an ER and you say, this is what I need. This is what I want. You have to push for it. Like, and, I have told people, I'm like, exaggerate your symptoms a little bit. Like if you had one bloody bowel movement, okay, maybe it is nothing, But you go and you say, I'm having multiple bloody bowel movements. So you get the colonoscopy because right now the colonoscopy age is 45, which is so crazy to me with the rates of colon cancer showing up in people's 18 to 35. And yet the colonoscopy age in the United States is 45. So I am just one that's absolutely like, advocate, exaggerate your symptoms to get what you want. I've seen patients working I'm a fairly new nurse practitioner to the ER. I've been in ER medicine for 10 years now, but I'm a new provider, and I've actually had a couple young patients come in who have had similar symptoms, and they're like, yeah, I just like, my primary doesn't take me seriously. And I'm like, okay, well, we're going to call GI here in the ER today. We are going to try and get this figured out, because you would think that with the number of cases that it would be like, okay, we need to lower the age. But I also understand that GI is like, with the increased amount of cancer cases and people needing scopes, they're overwhelmed too. There isn't enough providers to provide all of this care now with this like uptick. Advice that I'd have for anyone in this situation is that, you know, I hate it when people say this to me, but there is a reason for everything. There is a reason that we were chosen to go through this fight. I look at it as like, I was chosen to go through this fight so I could help bring awareness to other people. Like, we were chosen for a reason, and we need to be strong through this fight. We need to be there for our friends. Like, we need to be the ones that show that we can get through this. And there are going to be dark days. There are going to be days where you feel like you cannot go on any longer. I had plenty of those days where I felt like I don't want to wake up tomorrow. I cannot move on from this. But just know that we can. There is a light at the end of the tunnel. Like, there is a bright side, even though you don't feel like there is. And know that your feelings are validated. Like, I had people be like, well, like, look at, you're still here, like, you're doing great. But it's like, no, you don't know. You have no idea how this is feeling. And we are the only ones that will know truly how this feels. So just know your feelings are validated, but know that you can get through this. And I'm one to say, like, I'm always here to talk to anybody who's going through that, because I think us who have been diagnosed really only know how that feeling is.